Hi, everybody. Welcome to the January HRO2 podcast. I'm Jeanne E Poole, the editor-in-chief. This month begins our 6th year of publication. The prior 5 years has shown a steady increase in submissions to the journal, with a large percentage coming from outside of the United States. We are also excited to introduce our expanded focus on digital health and digital technology, reflecting the mainstreaming of these innovative approaches to healthcare into our field of electrophysiology. To support this effort, we have designated specific individuals with expertise in these areas to oversee the HRO2 digital stream. Deputy Editor Hamid Gambari will provide oversight and strategy. Nazim Akum and Sumit Mittal are designated associate editors and will be working closely with section editors Suraj Kappa and John Silva. So you can look forward to more papers that deal with these subjects. Well, we have all no doubt had a busy few months with the holiday season in many countries. And for this reason, in this January podcast, I'm giving you the titles and first authors and then providing the author's key findings. The first original article is titled Impact of Fat on the Left Atrial Roof Identified Using Intracardiac Echocardiography During Pulmonary Vein Isolation Procedures by Dr. Yuhi Hasabi and colleagues. The objective of their study aimed to determine whether fat on the left atrial roof could be identified using intracardiac echocardiography and whether its presence affects the procedure outcomes of pulmonary vein isolation. 94 patients were included in their study. The author's key findings are first, that fat between the septal atrial bundle and the septal pulmonary bundle on the left atrial roof could be identified using intracardiac echocardiography. Fat separating these two sites was present in 37.2% of patients undergoing pulmonary vein isolation. The fat region was associated with conduction gaps after PVI when it extended beyond the PVI line on the left pulmonary vein roof. The next paper is titled Trends in Healthcare Expenditures and Incremental Healthcare Costs in Adults with Atrial Fibrillation in the United States by Dr. Franz Serpa and colleagues. The objective of this study was to delineate healthcare expenditures amongst patients with atrial fibrillation, using the longitudinal panels from the Medical Expenditure Panel Survey covering 2016 to 2019 in order to estimate healthcare expenditures associated with AF. The author's key findings are first, that adults with AF in the United States face a higher financial burden across various healthcare services than do those without the condition. Second, the major drivers of expenditures in their study included hospital inpatient care, office-based visits, and prescribed medications. Third, expenses across various healthcare services have increased over time, placing a substantial strain on patients, providers, and payers. Finally, in their study, the estimated mean annual incremental cost of AF is $5,312 per adult, representing a significant financial burden on the healthcare system and patients. The next study's title is Novel versus Established Cryoballoon Ablation System for Atrial Fibrillation, a Systematic Review and Meta-Analysis by Dr. Jeanne de la Baillez. The objective of the author's study was to systematically review the efficacy and safety of the POLARx compared with the Arctic Front system. The authors performed a structured systematic database search for articles published between 2021 and 2024 that reported on the efficacy and/or safety of the POLARx system for AF ablation. The co-primary endpoints were the long-term efficacy and safety of the POLARx system. The key findings were first that in their systematic review and meta-analysis comparing the POLARx and Arctic cryoballoon ablation systems, they found similar acute efficacy with high rates of success ablation, 98.2% for POLARx and 99.9% for Arctic Front. Comparable long-term outcomes. Second, the POLARx system had a high incidence of phrenic nerve palsy compared with Arctic Front, 2.7% versus 1.6%, with a 79% increased odds of experiencing phrenic nerve palsy in the POLARx group. Third, and finally, there is a need for further studies, particularly on the newer POLARx FIT system, to assess its impact on phrenic nerve palsy incidence and to clarify the mechanisms behind the safety differences that were observed in this study. And the next paper's title is Catheter Ablation for Atrial Fibrillation and Risk of Neurologic Disease by Mohammed Al-Sadawi and their colleagues. The objective of this study was to determine the effect of catheter ablation on neurologic events during long-term follow-up. The authors performed a systematic review and meta-analysis of patients with AF who underwent catheter ablation of AF. Using the Medline, Embase, and Web of Science databases from inception to January of 2024, studies that reported incidence of CVA and dementia in patients with AF were evaluated for inclusion. Data from each study were combined by a random effects model. The results were then reported in risk ratios with 95% confidence intervals. The author's key findings are first, that catheter ablation of atrial fibrillation resulted in lower risk of cerebral vascular accident compared with medical management alone at long-term follow-up. Second, catheter ablation of AF resulted in lower risk of dementia compared with medical management alone at long-term follow-up. Third, prospective randomized trials with larger sample sizes are needed to validate the efficacy of catheter ablation for AF in reducing the risk of incident cerebral vascular accident and dementia across different patient populations and management strategies. The next paper is titled Electrocardiographic Correlates of Ventricular Arrhythmias and Repaired Congenital Heart Disease by Dr. Satoshi Kawada. The objective of this study was to evaluate clinical and electrocardiographic characteristics of patients with congenital heart disease based on the presence or absence of ventricular arrhythmias in 29 patients. The first key finding was that in their retrospective study, it showed that a wide QRS complex equal to or greater than 180 milliseconds and epsilon waves were significantly associated with ventricular arrhythmias in patients with repaired congenital heart disease. 2. Fragmented QRS was also associated with ventricular arrhythmias. 3. These electrocardiographic markers represented a significantly injured myocardium with conduction delay associated with the substrates for reentrant tachycardia. And finally, that assessment of the QRS duration and epsilon wave in patients with repaired congenital heart disease could improve risk stratification for the development of ventricular arrhythmias and could assist in clinical decision-making and might consequently reduce mortality. The title of the next paper is Electrocardiogram Sampling Frequency for the Optimal Performance of Complexity Analysis and Machine Learning Modules, Discrimination Between Patients with and Without Paroxysmal Atrial Fibrillation, using Sinus Rhythm Electrocardiograms by Dr. Stephen Creasy and others. The objective of this study was to better understand the optimal parameters for artificial intelligence-based detection for atrial fibrillation. The author used 10-second 12-lead electrocardiogram signals that were analyzed using complexity algorithms combined with machine learning techniques to predict patients who had a previously detected AF episode but had since returned to normal sinus rhythm. Then the authors looked at the impact of the sampling frequency of the electrocardiogram signal on the accuracy of the machine learning models that were used. The first key finding is that paroxysmal atrial fibrillation is a difficult condition to diagnose, but the use of machine learning can improve detection rates. Second, complexity analysis has previously been used in equine work to detect paroxysmal atrial fibrillation, but this is the first time it has been used in human patients. Third, sampling frequencies common in electrocardiogram devices were tested to investigate and formalize the process of using complexity analysis in the future. And finally, that these methods have achieved an accuracy of 70%, a vast improvement on the current long-term monitoring methods. The title of the next paper is Evaluating ChatGPT-4's Correctness in Patient-Focused Informing and Awareness for Atrial Fibrillation by Dr. Ivan Zaljokovic and colleagues. The objective of this study is to explore the correctness of ChatGPT in informing patients about atrial fibrillation. This was a cross-sectional observational study using ChatGPT-4 and responding to a structured set of 108 questions, about 10 categories related to atrial fibrillation. The categories included topics such as basic information, treatment options, and lifestyle adjustments. The model's responses were then evaluated by a panel of 3 cardiologists on the basis of accuracy, comprehensiveness, clarity, relevance to clinical practice, and patient safety. The total correctness of ChatGPT-4 was then quantitatively assessed through scores assigned in each category, and statistical analysis was performed to identify significant differences in performance across categories. The key findings are first, that within the comprehensive evaluation of generative pre-trained Transformer 4's correctness in patient-focused informing for atrial fibrillation, ChatGPT-4 can provide informative and relevant answers across different categories. Second, ChatGPT-4's performance tends to vary across different sets of questions. 3, ChatGPT-4 is reliable in categories with structured and direct queries. And finally, that ChatGPT-4 shows limitations when handling complex medical queries that require in-depth explanations or clinical judgment. The title of the next paper is Design of a Post-Market Registry for the Extravascular Implantable Cardioverter Defibrillator, the ENLIGHTEN Study, by Dr. Lucas Boersma and colleagues. This is a methods paper for the ENLIGHTEN Study. The objective of the ENLIGHTEN Study is that this is the EV-ICD post-approval registry to provide a comprehensive measure of the safety and performance of the EV-ICD system in real-world clinical practice over the lifetime of the device. The methods are that the ENLIGHTEN Study is designed as a global prospective observational multi-center post-approval study using the manufacturer's product surveillance registry. Eligible patients implanted with the Aurora EV-ICD system at participating centers will be included. Follow-up clinical data will be collected approximately every 6 months throughout the lifetime of the device, enrolling a minimum of 500 patients. The first key point is that substernal placement of the EV-ICD has been shown to be effective and safe in pre-market studies, but the real-world performance with the post-market Aurora EV-ICD system with novel discriminators, or SmartSense, is unknown. The ENLIGHTEN Study will be the first assessment of the real-world safety and performance of the EV-ICD using Medtronic's global product surveillance registry platform to allow 500 or more patients for the lifetime of the device. Finally, the study's primary endpoint is freedom from major system or procedure-related complications at 5 years post-implantation with a goal of 79%. The title of the next paper is Cardiac Venous System Mapping for Ventricular Arrhythmia Localization. This is a topics and review paper by Dr. Matthew Hansen and colleagues. This is a really nice review paper, and by way of summary, I will read the short abstract paragraph. The authors write, the coronary venous system offers a route for mapping and ablation of ventricular arrhythmias with suspected epicardial or intramural origins. Coronary venous mapping helps the operator to select the best ablation approach, decide when percutaneous epicardial access may be necessary, and provides an opportunity for therapeutic interventions, including radiofrequency application inside the coronary veins or ethanol infusion. In this article, the authors review the anatomy of the coronary venous system, the scenarios in which coronary venous mapping can be helpful, and the technical aspects involved in coronary venous mapping. I hope you'll take the time to read this really very interesting paper. The next paper is another review topic, and the title is Arrhythmias and Cannabis Use, a Comprehensive Overview by Dr. Shweta Palraj and colleagues. In a way of introduction, the authors note that there is an increasing prevalence of cannabis use and the link with a variety of arrhythmias. Further, they note that the tetrahydrocannabinol content in cannabis has increased and little data exists regarding increased arrhythmia risk. The authors go on to summarize the known literature and offer the following key points. First, the cannabis use has been noted to have a temporal correlation with arrhythmias. Second, atrial fibrillation is the most common arrhythmia associated with cannabis use. Third, that patients with channelopathies, structural heart disease, and prior myocardial infarction appear to have a significant association with cannabis-induced arrhythmias. Finally, there is a paucity of large-scale prospective studies analyzing the correlation between cannabis use and arrhythmias. Until more data are available, the authors posit, it would be prudent to advise patients with the previously mentioned comorbidities to avoid marijuana use. The next paper is yet another review paper. The title of this paper is Antithrombotic Therapy in Atrial Flutter. To anticoagulate or not, that is the question, by Dr. Fabian Wieselek and colleagues. This paper addresses an important question in clinical decision-making. In their introduction, the authors note that less attention is given to atrial flutter, which may occur as a standalone arrhythmia or coexist with AFib in the same patient. They acknowledge that current guidelines provide identical indications for anticoagulation therapy in both arrhythmias, given the lack of trials in patients with atrial flutter alone. In this review paper, the authors summarize the literature on this topic. The next paper was accepted into our Global Voices section. The title of this brief report is Sex Differences in Global Electrical Heterogeneity, the Hispanic Community Health Study of Latinos by first author Dr. Larissa Tereshchenko. The author's key findings are first, that this cross-sectional analysis of the largest U.S. Hispanic population identified differences by sex in vector cardiographic global electrical heterogeneity. Second, the female spatial ventricular gradient vector is smaller than the male SVG vector, and it points farther downward and posteriorly. The female spatial QRST angle and some absolute QRSTB integral are smaller than the male metrics. Next, sex modifies an association of prevalent CVD with SVG magnitude, and SI QRST and SAI QRST and SVG are smaller in men with cardiovascular disease and in cardiovascular disease-free men. But in contrast, SAI QRST and SVG are larger in women with cardiovascular disease than in cardiovascular disease-free women. Finally, female reproductive health history, that is age of menarche, menopause, parity, use of hormone replacement therapy, is associated with differences in VCG, GJ phenotype. I hope you take the time to take a look at this paper. The number of patients included was 515,684 patients, so it really does represent a good population of Hispanics in the United States looking at these significant differences. The next paper is a case report. The title is Radiofrequency Catheter Ablation by Persistent Atrial Fibrillation in a Patient with Core Triatriatum Sinister by Dr. Hideyuki Hasabi and colleagues. Here they describe a case of a 65-year-old man with a history of hypertension and diabetes who was referred to their institution for catheter ablation of symptomatic persistent AF for about 12 months. They identify core triatriatum in this patient, and they go on to discuss the anatomy and approach to ablation. The next paper is a research letter. The title is Feasibility of Ethanol Ablation of the Vein of Marshall in Patients with Coronary Sinus Leads by Dr. Niti Tokovanich and colleagues. As a way of background, the authors note that ethanol ablation of the vein of Marshall has been shown to improve outcomes in patients undergoing catheter ablation of persistent atrial fibrillation and post-AF atrial tachycardias. But this can be challenging in patients with LV leads. The authors then go on to describe their experience in 220 patients at Michigan Medicine. The last paper in our lineup is a very important document, and we are pleased to publish this in HRO2. This is the document titled Current State of Arrhythmia Care in Latin America, a statement from the Latin American Heart Rhythm Society by Dr. Ulysses Rohel and multiple authors. I want to tell you a little bit about this document. The abstract summary states that first, on May 18, 2023, the Latin American Heart Rhythm Society and the Heart Rhythm Society convened a meeting of leaders committed to arrhythmia care in Latin America to discuss clinical and healthcare policy issues and the barriers to delivering world-class standards of electrophysiology services, discuss potential future solutions, and share experiences and best practices. A questionnaire detailing EP resources, procedures performed, and number of EPs, as well as other critical questions were sent to 15 Latin American Heart Rhythm Society representatives from 15 different countries of the 20 that make up Latin America, and was completed by all of them before they convened a meeting. The working group then convened, and representatives from each country provided a report. Important findings included that first, atrial fibrillation is a major clinical arrhythmia-related problem throughout the region, followed by Chagas disease in some countries. Second, there is significant variability in access to advanced arrhythmia care, ranging from 5 ablation procedures and 16 device implantation procedures per million inhabitants in Venezuela to 189 ablation procedures and 617 device implantation procedures in Uruguay, due to differences in workforce availability. Workforce availability ranged from 0.36 electrophysiologists in Cuba to 1,303 electrophysiologists in Argentina, and that is per million inhabitants also. Third, they note that resources varied significantly, ranging from 0.74 EP centers per million inhabitants in Brazil to 4.68 EP centers per million inhabitants in Uruguay. They also noted the EP technology varied, ranging from 0 operational and new generation 3D mapping systems per million inhabitants in Cuba, Bolivia, and El Salvador to 1.98 operational and new generation 3D mapping systems per million inhabitants in Argentina. They also note that other differences across the countries included drug availability and national healthcare policies. Collaboration in the area already has occurred on an individual country basis, but no systematic regional efforts for working together is present. Furthermore, governmental healthcare policies are different between the different countries, and no opportunity for consistent in-country EP training where standardized goals and assessments are present. So the authors summarize at the end, and I hope you will read this, a call to action for a number of important initiatives that would start to overcome some of these deficits that are lacking in providing up-to-date, state-of-the-art arrhythmia care to patients across Latin America. So that ends the January podcast. I appreciate your attention as always, and we'll be back in February for the February podcast.